Assalamu alaikum, everybody. Welcome to the MRCEM Intermediate SBA Bootcamp. So this is going to be our introductory lecture. Many of you have joined. I was hoping to wait a little bit more, but I think let's just start. If we have questions, we'll take them in the end. Anybody who joins late can just watch the recording, and if they have questions, you have the groups to ask away. All right, so we do have people who are not in the course and then people who are in the course. Understandably, you both will have questions, so feel free to ask. Just leave them in the chat box, and once we're done with the presentation, it's a really short one, we'll get back to them. The purpose of this lecture isn't just to tell you about the course. That's not the point. The point is that if someone isn't part of the course, we want to just give you a direction, like a scheme to follow. If you can follow this on your own, that will help you with the exam as well. So we're going to show you the details of how you can plan starting from today, because you haven't applied for the exam yet, yes? So because you haven't applied yet, you are still in that phase where you're like, can I do it? Can I not do it, right? 10th of June is when you're going to apply. So you have 10 days to decide. So these 10 days, those who are part of the course are already going to do whatever we have planned, and we'll cover that. But those who are not are either going to be looking for resources, collecting stuff, making plans, making work arrangements. So I would recommend you to use that time very carefully. Make a plan. Kindly go mute, please. Thank you. All right. Make a plan how you want to frame it, because the syllabus is long and there's a lot to cover. Even if you're just doing one resource, you still have a lot to cover. Make a plan, find your weak spots. If you're a repeater, you already know your weak spots. If you're not a repeater and you're doing this for the first time, I would suggest do the topic that you are trying to avoid first, and then follow it up with a topic that you like to study, okay? That way you won't be bored. It takes a lot longer than primary, so do not underestimate this exam. Don't think that, oh, I can do it in the last few days if I just get my hands on the recalls. That's a bad approach to this exam. I wouldn't recommend going into this exam with this mentality. Now, having said that, targeted study is important. There's so much information, but only some of it is tested in the exam. And so it's your job to collect resources and figure out, what do I need to know about a certain topic? For example, chest pain, right? What do I need to know about chest pain? So chest pain, you need to know the things that can kill him and the things that can mimic those things. Simple enough. And now your job is to look at a blog or an article for RChem learning and read it in a way that you are able to exactly pick up which chest pain corresponds to which diagnosis on the basis of history, and which diagnosis requires a certain investigation to make sense of it when the history is inconclusive. If you go through all your articles or your study material or whichever book you're following, if you go through those topics with this mindset, you will pass the exam. Course or no course, you will pass the exam, okay? Now, this mindset and this routine takes a lot of effort and discipline. And this is where many people go for a course, only because they don't want to do this kind of hard work. They're like, just give me what you have and I'll read it and do the job for me. That's all there is. But even those people have to still study. You still have to study the notes. You still have to go through all the details and clear your concepts. Our job is to give you what we can to help you on your journey. But at the end of the day, even if it's my course, any other course, you do have to work hard. Please don't just be passive in your learning. In the groups that you've joined, whichever course you're following, actively answer MCQs. I do share them in our open group as well, and many of you don't answer them, which either means you don't know the answer, or it means that you think it's not relevant yet. Both of those approaches are bad. If you don't know the answer, make an educated guess. Go back and start learning about that topic. That's how you learn. And if you don't think like MCQs, I don't know enough to actually try and solve the MCQ, that's again a bad approach. I would still suggest go through the MCQ and see what makes sense. Go back to the topic, learn it, and go through this. RChem Learning is one of the best resources there is. I will only recommend that. The reason I do that is one, because it's based on your RChem guidelines, all of it. That's what RChem it's themselves recommend for your exam, other than Research UK and NICE guidelines. Plus, it's very concise, the topic. If you pick up the induction module, and I'll show you the induction module. If you pick that up, you'll be able to have basics of a lot of those topics, and that will give you the relevant information. And then you start doing the SBAs. Once you start doing the SBAs, you will feel that they're very, very difficult in the beginning. And you might think, oh, this might be FRChem level. No, that is MRCEM level. That's not FRChem, number one. Number two, there's a very minor difference between MRCEM and FRChem, and that's between the SLOs 8 to 12. They have added new SLOs, but the rest of the MCQs are from the same guidelines, same material, same stuff. So if you find an MCQ difficult, don't think it's FRChem. Raise your level of understanding, okay? All right, so that was just one preface that I wanted to make sure that we get through. Now let's jump right into some of the basics of the MRCEM Intermediate. Things that I know most of you know. Just a little bit of an introduction about me. I'm Dr. Taju Shariar. I've completed my MRCEM about 2 years ago now, working as a consultant emergency medicine in PF. I do work as a QIP and audit lead, a teacher, trainer, and mentor. And now I work full-time as a mentor at GoldenEye EM as well. We've got in our mentors team for our SBA, we have Dr. Saqib and Dr. Sabah. Dr. Saqib is also complete MRCEM, currently urology trainee, and has done his USMLAs 1 and 2. And he's a full-time mentor here at GoldenEye EM. He's going to be helping us with all of you. Let me see if he's in. If he's not, he's probably going to join soon enough. Okay. Then you've got Dr. Sabah. She's also done her MRCEM 1 and 2. She's awaiting OSCE, working as a registrar, and she's also a full-time mentor. Probably the primary candidates, if they are there, who've joined us for the intermediate one, they have seen how they teach. You will be seeing them again teach in intermediate. Now, the other thing why this course is because I have not used any other guidelines, just RChem, that's it. And I've tried to make it easier for you to understand RChem guidelines because they are a bit too vast. All right, now let's get to how to break down your syllabus for all of you now learning to study. We've all gone through this. What is the MRCEM Intermediate SBA, right? We know there are 2 papers, 90 MCQs each. There is a standard cutoff. The last one was at 120 out of 180, which is 65 or 66%. Results are usually 5 weeks after the exam. Oh, the platform isn't Pearson VOE anymore. It's now Spectre or Sphere something, as far as I remember. That was the same platform for primary recently, so they've switched over. Second, this is your blueprint. How to divide your time among all the questions, okay? First one up is SLO1, which is 60 questions. But these 60 questions come from roughly 24 topics, okay? That's really vast and very difficult to take under control. Second is SLO3, which is a very specific topic. It's just ALS, APLS, ATLS, NLS, so all your research UK guidelines, and organ failure, and some of those governance guidelines that can overlap with SLO7. This is a very narrow topic with a vast number of questions, so 40 questions. My advice would be to work very, very hard on SLO3 and SLO4. Okay. Many of my candidates in the past even, they are more worried about SLO7. Oh, there were so many questions. I can assure you that they're not going to give you more than 15 questions. Even if many of those questions feel like SLO7, they're not. They're also covered under many other SLOs. So do them correctly. Do SLO3 and SLO4 correctly, which is, look, 40 and 30. That's 70 questions. That's a lot. And then focus on SLO1. Okay, so how much is that? 60, 70, 100, and 130. So that right here kind of goes above your pass mark anyway. Okay. Now I know it's not possible to score 4 marks in all of these SLOs, right? So we compensate with the rest. These are easy marks, like SLO6, easy marks. SLO7, easy marks. Pediatric EM, a little bit trickier, but you can still get like 10, 12 at least. But if you are scoring poorly in 1, 3, and 4, you will not be able to pass the exam. So the maximum amount of time should be given to these SLOs. Now, SLO1 is very vast. My advice would be that come June, like before you apply for your exam, you have 10 days. In these 10 days, start working on SLO3. Go through everything in MRCEM learning regarding SLO3. You will be preparing not just SLO3 actually, you will actually be covering SLO1, 7, and 4 overlapping, and even a bit of SLO5, because SLO3 has overlapping topics from all the other SLOs. So if you start working on SLO3, you will get a baseline knowledge of yourself. You will get into that study mode, and it's fairly easy to build concepts on. It's not that difficult. So I would suggest starting with SLO3 and then moving on to others. So this is your SLO1 deep dive. These are all the topics that they test. Anaphylaxis and allergy, you will have 1 or 2 questions, and very easy topic. Elderly care and frailty, I understand if that is a little bit difficult. And this will also be overlapping with your SLO3 and SLO7. There's some old age related governance guidelines. Hematology, 1 question maybe. MSK, 1 question. Oncological emergency, 1 question. Respiratory and cardiology, you might have a few, so focus on these. Cardio is specifically very important. Endocrine, again, a few questions. I wouldn't recommend skipping any topic, by the way. Please don't skip it entirely. It's just that don't give them too much time. That's all I'm saying. Infectious disease, heavily tested with pharmacology or toxicology, so do focus on this one. Nephro, again, with cardio, respiratory, nephro, neuro, these are like the big guns you will be tested on. Try and do the utmost important emergencies in all of these topics. You will have some questions from ophthalmology. Sexual health, less likely, but this cannot actually overlap with infectious diseases. So you might see a mix of these, or with OBGYN. That can also come in all of this together, like a mixed question. You will have some images for dermatology, some rashes and things like that. Do read up on it. Environmental emergencies can overlap with SLO3 as well. Maxillofacial can overlap with SLO4. Neuro can overlap with 3 and 4. So be careful. There are a lot of images with neuro, maxillofacial that you want to cover. Surgical emergencies are for sure going to give you x-rays. So do look at all the MRCEM related surgical emergency x-rays on their system. ENT, not that important. You will have 1 or 2 questions, but they're fairly easy, that you will be able to do them fairly easily. Gastro, they are going to test hepatitis, so do read up on the titers and things like that. Many people just find that difficult to make that table, the hepatitis B, C table, they mean immunized, non-immunized, and read up on it. Mental health, you're going to be tested for sure, especially with pharmacology, okay? Mental health drugs, side effects with pharmacology overlaps, they're going to test that. OBGYN, most emergencies and infections. That's what it's going to be about. Urology and vascular, again, just the core emergencies only, very short topics. The reason why I'm telling you what can be tested in these topics is because I want you to focus on those only. Don't waste time on studying everything in dermatology. Study what's important, what can be tested. That's all there is. Okay? If you have questions, just keep asking. Oh, sorry. All right, so my study toolkit that I used in my exam and what I recommend to everybody else is one, MRCEM Learning. It has everything in just one place. I don't have to worry about anything. Secondly, it kind of once you become a member, you get an exam discount. So best resource ever. If you are from a low-income country, you are going to get just £45 membership for the whole year. So, and also just email them saying that you are from a low-income country, so they will lower the price for you. MRCEM curriculum, this I would recommend downloading and printing. It's in our open drive that we have shared with you. Download it, print it out, and mark it every time you do a section. That will really help you stay focused when you're preparing for your exam. The others are your recess guidelines. So all of your ALS guidelines, ATLS guidelines, all of these have been updated and shared in the group, the Telegram group that we have for the course candidates. If you can print them out and keep them with you, sure. If you think you can study effectively with a soft copy, go ahead. These are some nice guidelines I've mentioned. They've recently been updated. Our notes have the updated guidelines. If you're studying on your own, use a VPN to access NICE guidelines and then get the visual summary, okay? Because NICE guidelines are really big, right? Either go to the PDF, download the NICE guidelines, view the PDF, give it to Notebook LM, get it to summarize it for you. That way it's going to be easier. Notebook LM does not hallucinate. That is a very good resource to use. If you're doing this on your own, that would be the best thing to have as a study partner. And for somebody who isn't doing on their own, they have people or they are studying in a group, you can just go to visual summaries and have that visual table. They have good charts in NICE guidelines that you can use just for revision. All right, now how are we going to study? This is how our course is designed. But if you wish to follow this as well without the course, if you don't have the means to join a course, and if you feel you are confident you can do this on your own, feel free to take a screenshot and follow along. You can do this with yourself. You can just start studying. We are starting our offline video library. But what that essentially has is every topic that you see in the curriculum, the MRCEM curriculum 2011, that we are going to cover topic-wise, okay? We're going to go and start with SLO1 and SLO3 mixed topics because it overlaps a lot. So we're going to do that first in the full June is going to be SLO1 and 3. Roughly about 5 lectures a week. We're going to give you a break for 2 days at least. So we're going to share 5 lectures a week. And we're going to start with that. But if I feel like, candidates are having some trouble, we might decrease the frequency. And if we feel, no, they're able to do a lot more than this, we might start increasing the frequency. It depends on our course candidates. But roughly our plan was initially to share 5 topics a week. Whenever we share the topic, it's going to be a 2-hour lecture video. 2 hours, they will watch it, and then we'll have a discussion in the Telegram group with some MCQs just to consolidate those concepts. We'll share some important points, notes they have to go through and study. That way we finish everything. So SLO1 and 3 first, then we move on to SLO4, then 5, 6, and 7. And our plan is to finish all these SLOs topic-wise before 20th of August. By 20th of August, we would have at least covered the syllabus in our minds, would have covered the syllabus at least for once. Then we work towards revision because now we have to revise all of it. And revision sessions are going to be live. They are going to proceed in a very orderly fashion where we're going to do 2 lectures on SLO1. Each mentor is going to pick up the lecture. I'm going to show you who the mentor is going to be and what our plan is. It's going to be 2 lectures on SLO1, 2 on SLO3, 2 on SLO4, because these are vast topics. And we are just going to get you into that revision mode before your exam. 1 or maybe 2 on SLO5, depending on how Dr. Sakib decides he's going to do that. SLO6 and SLO7 are going to be just one revision topics. They're not that vast. We're not that worried about it. And then side by side, we will be running your mocks. So not only will you be revising, your mock exams are going to be conducted on Google Quiz. You will submit those mocks. You do have the flexibility of doing them whenever you're ready and then submitting them. The discussions are going to be done in the late hours of the day. So it's going to be 10 p.m. to 12 p.m. in the Telegram group. We're going to be discussing the MCQs, if they have trouble, anything they need to time it. Now, anybody who is not using a course, what you can do is you have these offline subscriptions. If you have taken an MCQ subscription, you can do those mocks in that time. You can do that with your study period. If you haven't even taken an MCQ bank, then just use the offline resources that many of these are available offline, I would say. We have some resources available in our Open Drive. Just load them up into Notebook LM, all these MCQs. And then the Notebook LM has a quiz feature. You can generate questions. And that will give you that quiz feel. If you are just, not going for any course, any question back, and you still want to study, that is still a way to study, free of cost. So you are free to use that. Take it as you will. I would really recommend using Notebook LM for your studying. Even if you do have a course, it just kind of helps you check your contacts. It really will help. All right, so that was the plan here. Oh, we do have a rapid revision just before your exam. These rapid revision sessions, these sessions, 13th and 14th, these are basically recall one-liners. And we're going to do them just a few days before the exam. The reason is, doing them a lot earlier, you're just going to forget. And secondly, recalls are best done a few days before your exam so that when you look at the stem, it clicks and it makes sense. That's the only reason. We're going to cover the rapid revision is going to be SLO-wise recalls. That's what it is. We're going to go through it very, very quickly. We also have some special sessions. I've mentioned them here in phase 1. However, our plan is to do these live somewhere. We will fit them in. These are going to be on ECGs, commonly seen ECGs, X-rays, and images. Not that we haven't covered them already in the offline video when we did the SLOs, but it's just separately done right before your exam just to revise all those images and X-rays and ECGs so that you have revised these things that are very commonly seen in the exam. This is just another showing how many lectures are we going to have. This isn't exactly, I would say, true. These are based on the topics that your RCEM 2021 guidelines suggest, 2011 guidelines suggest. So these are all the topics, like 28 lectures, like 28 topics. These are 8 topics, 6 topics. We might be combining them in one video, so you might not see exactly these number of lectures. But our aim is to make sure that no lecture is more than 2 hours. We're going to keep them short. We're not going to extend more than 2 hours because we know that you're not going to be able to focus. So if a lecture is going over the 2-hour mark, we'll divide it and we'll share it the next day so that you're not overburdened with it, okay? All right. This was our live session plan. The live lectures from 22nd of August. My suggestion would be, those who are in the course, please, if you can, try and not be on duties during this time, like when the live sessions happen for your exam, okay? These are tentative dates. They are not exactly fixed yet because some of the mentors haven't gotten their schedule for August. But once that happens, I'll let you know. My lectures are confirmed, like these will be mine. However, if some other mentor has their duty at some point and I can replace with them just to give them that relief, I might do that. So these dates we're still working on, don't worry. But I will finalize them even before July comes around, so don't worry. I would recommend that all of you join live, because the recorded lectures are good and you are studying, yes, but I will not be able to tell what your weaknesses are unless I see you in the live sessions trying to do the MCQs, okay? Do this with us so that we are able to focus on your weakness. And once we figure out what your weakness is, we'll start targeting your weakness. We will be giving you those kind of questions more to solve in the Telegram groups, or maybe help you with some notes or anything that we can do to like clear that concept for you so that you're not making those similar mistakes. Okay, I hope that makes sense. All right. This was just the mocks. All your mocks are going to be first SLOIs except for 6 and 7. They're very less questions for 6 and 7, so we've just put them together. Then you'll have a half mock and a full mock. Now, how to use MRCEM effectively. I did do a webinar before where I showed you how to use it effectively. For those going for the course, you have to watch the lecture, use the notes that we've given you in the drive, and then go to MRCEM Learning and solve any MCQ or SBA there and see if that makes sense. Okay? If it doesn't make sense, we're going to try and make it make sense somehow. Okay? That is how you know. If you are able to solve SBAs on MRCEM Learning module after reading up on the topic, that means you understood it. If you're not able to solve it, that means there's some deficiency on our part that we were not able to help you get to that concept. So we'll try our level best to, get you to reach that concept. However, we do ask a few things. When you're watching the lecture, please have a pen and paper with you. Keep your phone away. Don't be looking at your phone if you're watching on the laptop. If you're watching on the phone, obviously you don't have a choice. Avoid distractions. Make sure that those 2 hours, you're not distracted by work, in the kitchen, with kids. Just give 2 hours a day. That's all we ask, to consolidate those concepts. And you will thank us later. Okay? Once the modules are complete, you can review the guidelines. Here, again, you don't have to review the actual guidelines. You can just review the notes. We've put the guidelines in the notes, so you have that advantage. If you are, doing this on your own, just review the guidelines. That's all you have to do. And then obviously attempt the recall bank that we're going to share with you in the Telegram groups. We're just going to share some MCQs regarding that topic. And whoever was the mentor for that lecture, they're going to be available in the Telegram group, answering your questions, helping you solve the MCQs, helping you figure out where you're going wrong. Okay? All right. Let's skip that one. We've already got enrollments. Okay. So that is all about the course and how you can study on your own as well. Okay. Start with MRCEM Learning and the blueprint. Make a plan and then follow through. Any questions before I show you how we made a chart that you can also use for your own study if you want to? Anything you have to say, or any of you have questions? I'm asking both the candidates and the non-candidates, because this is our first interaction and I know many of you might have questions. Do we need any extra notes? If you are part of the course, no. Will we be getting the lecture tomorrow and at what time? The plan is to share the lecture at 7 p.m. The lecture is going to be shared by 7 p.m. and then by 10 p.m. we start discussion. And the discussion is going to go from 10 to 12. Yes, Samira, you have your hand raised. How can I help?
Hi, Touchware. I was just wondering, when I was using the MRCEM Learning as a resource, there were some SBA questions along with the MCQ questions, but it doesn't let me answer those questions. It always say not available or something. Have you encountered those difficulties?
Were you logged in and are you a member?
Yes, yeah, I'm logged in and I'm a member. So I can do the MCQs. So,
Yeah.
but with the SAQ questions, it it doesn't take your answers, if it makes sense.
Okay, they might be phasing out SAQs. I wouldn't do the
Mm,
SAQs.
okay, fine. But
Yeah,
I
then
think it meets with SAQ and MCQ. So like for
mhm.
10 questions, it has 2 or 3 SAQs and the others are MCQs.
Okay, probably an internet glitch. I'm not really sure, but usually it works. Like the SAQs do work.
Yeah,
Um, However, for your exam, SAQs are we don't have that exam pattern anymore. It used to be the exam pattern before. That's why
yeah,
they have that on the website. But I felt like SAQs, when I was doing my exam, SAQs did not help me in my preparation. It would actually
yeah.
make it difficult for me because then I wouldn't be able to narrow down my answer,
Okay.
which was the
Yeah, yeah,
problem. So I would recommend going to the SBA so that you're able to like pick up the stem. Like, what am I looking for? What
yeah.
are these things in the stem that help me pick the correct answer in the MCQ option? So that is the recognition you need to work on.
Yes, yes, yeah. Since the MCQs are more important. And also when I'm doing the learning session,
Mhm.
after that, do I have to do the, there is something else after the learning session. Do I have to do the MCQs?
Where? The learning session MCQs?
Yes,
Yeah, why not? They're actually very good.
yeah,
They're very
okay.
SBA based. Like the MCQs in the learning session and the SBA itself are very
SBA, yes.
realistic exam questions.
Yeah, thanks. Yeah, thank you.
You're welcome. Okay, Maheen, you have your hand raised. How can I help?
Yeah, hi. I have subscribed to your course. I would like to know if we miss a lecture, when will
Mhm.
we get it? And also, I would like to know is this time 10 p.m. Pakistani time to 12 a.m. Will you follow it on daily basis or it's subject to change?
For your offline lectures, they're going to be shared in the Telegram group. They're available to you at any time whenever we share it. The discussion is if I have a topic, like if I'm sharing a video, then my time is fixed 10 to 12. The other mentors, Sabah and Saqib, are here. They can better answer if they change because they do have night shifts. I don't have night shifts, so I don't have a problem, but I have day shifts. They have night shifts sometimes, so they might switch their timetable around, but my lectures are going to be fairly on the same time. They're not going to
Okay,
change.
and will we have lectures on daily basis? How many times, how
That
many days a week?
is a bit subject to change, honestly. I was thinking 5 lectures a week because I don't want you to work through weekends. Everybody has family, everybody has days off. They do want to spend some time not, trying to think of the exam. And I don't want that to be like become a problem that we keep sharing videos and then you have a pile of videos to watch that you haven't. So that is not going to be a good thing for all of you who are going for the exam. So probably we'll share 5 videos a week so that you have that 2 day buffer where you can actually watch any video you missed and then work yourself up before the next week starts. I hope that is okay with everybody. If you feel even 5 videos are more, just let us know. Okay, I have to keep an eye on the chat. Anybody else has questions before I read the chat questions? Um, okay, I'm just going to go through some of the chat questions. Will we be getting the lecture tomorrow? And what? Okay, answer that one. Are lectures available offline? Yes, they are. They will be in the drive. They will be on Telegram. We'll share them on Telegram first, one by one. All the lectures are in a drive. So anybody who joins late or wants to catch up on something or wants to watch the lecture again, they can. Can we get it in the morning? Well, it depends on your consensus. I'm happy to share it in the morning if that's how you want to do it. If nobody else has a problem, I thought that maybe if you just watch the lecture and then do the MCQs, go ahead. I can share it in the morning. You can watch it before 10 p.m. anytime you like. and then we can have a discussion. I'm happy with that. No issues. Does the course contain RChem Learning PDF? It does. I have shared it already in the Telegram groups. I am sharing them, like, I think some of it is shared, most of it is shared, I'm not sure. But yeah, there are MCQs. Whenever I do a module, I share whatever module I've done, just important points and stuff like that. Please share lecture in the morning. Okay, we don't have an issue with that. So that we can listen whenever convenient. Yeah, that makes no sense. So I will. In June, only offline lectures? Yes, not just June, actually, till 20th of August. Offline lectures with discussion. These lectures aren't exactly, well, offline. It's just that we're not giving them live. We do sit and record them for you, and then we have a discussion in the Telegram group. All of the guidelines were recently updated, so we do have to make all the lectures again. It's a good time, 10 to 12. Okay, add video to Google Drive. Okay, which video? You mean all the course videos, Dr. Hassan? If that's what you mean, then yeah, they're already in. We have a whole drive. I'm going to share the link after the session ends for all the notes that we've already updated and uploaded. For the videos, everything is going to be shared. But that doesn't mean that you just focus on the notes. I would still recommend you be an active participant in the Telegram group. Have a discussion, keep clearing your concepts. Prayers requested for primary result. All the best for your result. And I know most of you are going to pass. Shouldn't we start with blogs or clinical cases? That's your choice. Okay. The thing is, read the blog, then do the learning. Don't just there are many there is a learning module and then there is an SBA module of the same topic. So the learning module is where actually they give you a little brief topic to read. Then you do the MCQ. You read something, you do the MCQ, read something. So that's a learning module. And then there's an SBA of the same topic that you can do. That's a testing module. So that's also helpful. Blogs are really good if you are trying to cover a topic. They're really good. I do read them often whenever they update it. So yeah, why not read them as you wish. Is this session available offline? Yes, this session I will put on the YouTube channel for all of you to see. So we're not going to hide this, don't worry. I am having difficulty with Telegram. What difficulty are you having with Telegram? SBA 2026-03. Which major question bank? Oh, it's Hina. Hi, Hina. What's the difficulty? Are you not able to download it, make an account? And have you tried a desktop, like a laptop? Also, do try it with a good internet. It should help at some point. If nothing works, I'll probably set you up with the drive link so that you can watch everything on the drive. But since the discussion is an important part, please do try to work out why Telegram isn't working. It does work with a good VPN. I use Super VPN. If that helps, you can try that. It works on the phone. It works on my desktop. Which major question bank? Fakiha. Which major question bank? As in, what would I recommend? RChem Learning is the only thing I recommend, honestly. What would be the topic for tomorrow? Very good question. Let's see if my mentors are here. Dr. Saqib and Dr. Sabah, are you here?
Yes, Doctor, I'm here.
Yes, we are here.
Nice to meet you. So these are going to be your mentors, guys. Probably I'll share, what do we have? I think it's allergy. Let's start with allergy first. I will share the week, like 5 videos that we decide to share every week. We're going to share the schedule for it. We're probably going to do it week by week. I can't share the full like monthly thing because we're still in the process of recording. And we do have to see the mentors availability for discussion. So that's why. We'll probably be able to give you a week's schedule in advance. For tomorrow, it's going to be allergy. And who had allergy? Was it you, Sabah? Are you available tomorrow for discussion as well?
Yeah, I'm available.
Okay, so we'll do that, inshallah. Okay, any other questions? Is RChem question bank sufficient? The RChem learning is, yes, mainly because RChem themselves only recommend RChem learning along with NICE guidelines. The only reason you might think RChem learning isn't sufficient is if your concepts are not clear. You will struggle. My advice for concept building would be not if you like, I'm not talking about those who are in the course, I'm talking about people who are not in the course. My advice would be to either watch videos, like lecture videos on YouTube if you can find any. Otherwise, the other way you can learn is just put that topic, the RChem topic or blog, in Notebook LM. Ask it to summarize it, ask it to explain it to you, maybe use their video feature or their audio feature to let it explain it to you in a podcast or a video way. Any way you can use it to learn that concept. Once you get the concept down, you will not find the MCQs difficult. That's all I can say. The lectures will be shared on Telegram. Yes, the offline lectures will be shared on Telegram. They are available on the drive, but they're not like, well, all the lectures are there in a pool on the drive. We will be sharing them one by one in Telegram. So like for tomorrow, it's going to be allergy that we're going to share. So if you want to follow along as part of the course, doing lecture-wise, then you can do that. Also, you do have access to the drive, so you can just watch all the lectures in any order you want if you don't want to follow along. So it's up to you. How many study hours daily you recommend? Technically, I don't recommend any study hours. The reason is I believe in concept building. If you understand the concept in 15 minutes, you're done for the day. I'm happy for you to be done for the day. If you are struggling even after 2 hours, you need to put in more hours to understand it. So it's about your understanding. If I talk about, let's say I talk about your ALS guidelines, right? If I can close my eyes and tell you the full bradycardia algorithm, okay, so if the patient is symptomatic, that means syncope, chest pain, recent MI, this happens, they're symptomatic, let's start with atropine 500 micrograms. That's what I'm going to give. If I can verbalize the algorithm and then apply it effectively for my SBA, like the RChem learning, I open it, I do the MCQ, and I get every question correct, good. If I get 75% of my MCQs correct, I will analyze the rest of the MCQs I got wrong, and I will have to see what happened, okay? So it's up to you how many hours you do. I would recommend shorter hours, but focused ones. So if you're watching the video, for example, focused 2 hours, close everything else. Everything else can wait. But if you're distracted, you might be spending 5 to 6 hours and you would still be stuck. So that's my take on that one. What was your technique for SBA? My technique for SBA was, well, complicated. I failed my SBA twice, okay? The first time around, I was looking for shortcuts. And I thought that I could do the same thing I did in primary, look for shortcuts. Primary was, in a way, easier. And I thought SBA is going to be the same. The second time around, I thought like going for just a question bank and recalls would help without actually understanding the MCQs. Like if I do the MCQs on repeat, 15, 20 times, I will get there. That wasn't the case. So the third time around, I stopped looking for shortcuts and I just did RChem learning. I built the understanding required to pass the exam and I was able to do that. I have a YouTube video on how to solve the SBA MCQs, like what to look for in the stems. Sometimes they can be cheeky with the MCQ stems, asking for like which is not the answer, or what would you do first, or what's the next best step, or what's the best diagnostic thing to do, things like that. So I'll share it in the open group for everybody just to have a look at how to be able to solve MCQs in the SBA and what to do when you don't know what the answer is, how to apply your rule of elimination intelligently to get some of those questions where you are actually, guessing to make an intelligent guess instead. Can you please share the drive link for the recorded lectures on Telegram? Yes, I haven't shared the lecture, the drive yet. I will share it after the session. Don't worry, nobody has access yet. Okay, any more questions? What time is it? Oh, we still have 10 minutes. Anything you want to know for the course, because this is the first time we are interacting since you guys enrolled. Just want to know, how can we help? And also, I also want to know anybody in the group who has given the exam before, they failed. I would like to see your mark sheets. So figure out what your weaknesses are, and I'm going to send you your weak SLOs and your weak topics to focus on. We're going to work extra hard on those things. For anybody doing this the first time, you know your weaknesses. You know there are some topics that you absolutely hate covering. So whenever you open those topics, you're like, I don't want to do this. Tell me what those topics are so that we make it easier for you. Okay? Dr. Hassan, if you can send me your detailed breakdown, or if you are not comfortable sharing that, just share your SLO breakdown to let me know which SLO was really bad. And we'll figure it out for you. Sadia, resuscitation. I've seen, oh yes, Eamon, you have, did I send you a detailed breakdown in? Did I give you an answer or did I forget? For Sadia, resuscitation. Many of you have said resuscitation you struggle with. The reason why you do that is, I feel, that's just my opinion, because you haven't actually done a Resus UK ALS course or an ATLS course or an APLS course. You haven't actually applied those guidelines in practice, which is why you struggle with it. And because you work in a system that doesn't use those same guidelines daily. So you do something different in your actual daily practice, which is why that's a problem. So my advice for the next few months, I don't care where you work. I don't care what guidelines you follow. For the next few months, in your emergency department, you will follow Resus UK guidelines. All ALS, you have a bradyarrhythmia, follow ALS Resus UK. You have tachyarrhythmia, follow ALS Resus UK. If you need to print out those guidelines and carry them with you every single day, do it. If you have to paste them in your room, in your emergency department, go ahead. It's just for a few months. Ask permission and then put them up. Put those posters up and look at them daily. That's how you improve your Resus. Amen. I am so sorry if I forgot. Can you send it to me again? I get so many messages, so there's a very likely chance that I would have forgotten. And so, yeah, I would definitely look at yours again and get back to you. Yes, you gave. I gave what? Oh, Sadia, I gave you detailed. Okay. For anybody struggling with Resus, and even if you're not struggling with Resus, I would still suggest do this practice. Sometimes, okay, learning harder isn't the answer. Learning smarter is. Not everything has to be learned the same way you did back when you were doing metric and O-levels, okay? Sometimes repetition is key. Resuscitation concepts and what step comes next just takes repetition and how often you do it. It will become a secondary It will just come naturally to you. When you read the answer, you're like, okay, that's the answer. Anaphylaxis, what do you do first? Lie them flat, make the bed flat. Okay, that's in the guideline. If you look at the algorithm, they've made this guy lying flat, raise the legs. So you have the guidelines, just you need that eye to read it properly. That's all. And you will only read it properly if you're actually applying it to your patients. Okay, I'm nervous if 3.5 months are enough for prep. I would be too. I would be nervous. I agree. Are they enough? I cannot give you a yes or no answer for this, Fakia. The reason is I don't know your circumstances, okay? I don't know your baseline. I don't know where you're starting from, and I don't know how motivated or willing you are to put in that effort. All I can say is, if you are somebody who's working in the emergency department, are able to give me at least 3 hours of focused attention every day and clear your concepts, you will pass it. But the aim is to clear the concepts. The aim is not to get the MCQ correct or score high on a mock exam if you are just making guesses, okay? For example, out of 20 questions, if you guessed 10, you're like, maybe. You were confused between 2 and you made an educated guess and you got it right. That's not an accurate assessment. You should be confident when you do the MCQ. That is you understanding. And how to check your baseline, there are 12 SBA quizzes. I would advise you to do at least the first 6. See how you score. If your score is above 70%, you have a good baseline. If you're scoring way below, you don't have a good baseline. We need to work on a lot of topics. So that's one way to check. There are 12 SBA quizzes on the website. You will not have any of those questions in your exam. These are just questions that assess your baseline. And these are the questions, whatever is being tested in those questions is the guideline you want to pick up and read, because that guideline is going to be in your exam. They won't give you the same question, but they will give you a relevant question. I hope that makes sense. Right, any other question? Oh, and many of you have, I didn't realize there was a drive shared in the Telegram group, the rapid review. There are rapid review notes in it. Those are relevant notes. However, the guidelines have been updated, so I'm updating those notes, okay? You can study from them. They're not wrong. It's just that they don't have the updated guidelines. So some of the there have been some changes, and I'm implementing those. So you will have the new notes shared soon. But yeah, just so you're aware, the rapid review drive that you have has old notes. I'll share the new one. So make sure that you're not confusing the old drive. Can you please share them also on Google Drive? Can I share what on Google Drive? They're already on the drive. Oh, you don't have access to Telegram yet? Yeah, I will. Don't worry. I'll message you the drive. Don't worry. The notes, they're on the drive. I'll share them. All right. So anything you want to say, Dr. Saqib, Dr. Sabah, any advice to them going for SBA? They are much more intelligent than I am, by the way, guys. So
No, Dr. Talbot, not at all. First of all, thank you so much, Dr. Talbot, to give me a chance to speak in front of all the candidates. So, yeah. So, candidates, my name is Dr. Sakit, and I am the emergency medicine specialist. So, when it comes to the MRCEM SBA exam, so my background is I passed my all components of MRCEM and all components of PLAN and USMB steps as well. So the purpose of telling you all this because I'm going to give you an idea about the MRCEM SBA exam, and I am in the better position to tell you and compare the components of the other exams as well. So yes, Dr. Tajwar is really right that MRCEM SBA is really a difficult component in all parts of the MRCEM, even from the OSCE exam as well. It is my opinion. because in MRCEM SBA, most of the candidates will do similar mistakes that they will compare the MRCEM SBA from the MRCEM primary, and they will start just memorizing the Q banks and just memorizing the answers from the Q banks as they did in the MRCEM primary. So this will not going to be work in MRCEM SBA. So first thing is you have to work on your background. You will have to work on your basics. If you will have more concepts, if you will have your concepts very clearly, then you will be able to pass the MRCEM SBA in a very first attempt. But otherwise, if you just memorize the questions, or if you just memorize the answers from the different resources, so you will be landed in a trouble when you will sit in the MRCEM SBA exam. So this is my advice. And I will provide you the lectures. I will provide you the 9 recorded lectures from SL1 to Dr. Talbot. They will give you the link from the Google Drive. So my advice, once you listen the lecture, to start preparing the notes. First, use your laptops or iPads to start making your flashcards or your own flashcards, your own Anki cards. Okay, try to make your notes anyway. Okay, because in the end you will have to revise at least 2 to 3 times. You will have to revise the syllabus of American SBA, and the American SBA is a very wide syllabus.
Is it my side or are we not able to hear Dr. Sakib?
We will available all the time. We will give you the answer if you will have any difficulties, or we will arrange the online sessions as well if we feel that most of the students or candidates will have the similar kind of problem. Okay, so these are my advices. One thing I want to tell you that the American SBA, regarding the American SBA, the RCAM actually this component is basically the last component where the RCAM wants to judge your information regarding the all parts of the emergency medicine. In the OSCE, we are not just judging your knowledge. In the American SBA, we are going to judge the knowledge regarding the all aspects of emergency medicine. That's why it is going to be the most toughest component. So I would just want to give you the advice to make your notes and ask if you will have any kind of difficulties to your mentors, Dr. Tajwa, me, or Dr. Sabah. Okay. And so that we will start giving you the correct pathway initially, and we will help you in the beginning so that you will be able to uh, make yourself will be better when you sit in your exam. Okay?
Thank you, Dr.
So
Sakib,
do you
for
have
your
any
advice.
questions?
Dr.
So
Sabah,
thank you.
let's hear from you.
Hello everyone, thank you so much and welcome to the course. Dr. Tajwar and Dr. Sakib has covered everything. Only tip I can give you, I am used to make the flow charts. Just make your flow charts when you are making the notes. So make the flow charts. This is the first step. This is the next step. Because these are the flow charts which will help you in your decision making when you are solving your SBA MCQs. All other things are covered by Dr. Sakib and Dr. Tajwar. Thank you.
You're welcome. All right. Anybody else has any questions? You've heard the mentors. They are correct. You do need to have a pen and paper at least, minimum, with you. And don't make notes on digital stuff, okay? Try to write it down. That will help you retain things. I feel I am I am a visual learner. You would be able to tell what kind of learner you are. If you learn from images, make flowcharts like Sabah said, it really helps to visualize what's going to come next. If you're somebody who likes making their own notes, go ahead, make your own notes. If you're somebody who just likes reading someone else's notes, you have the notes. And that's what I wanted to show you, by the way. Let me just see if I can bring up the drive so that I can show you. Okay, no, not the drive. I'm going to show you the notes that we are working on so that I can help you understand how we're going to study or how you can utilize those notes, okay? Let's see, where is it? Where is it? Where is it? So this is a PDF of pharmacology in poisoning. I'm just going to share my screen so that you can see it. Okay, so this is what it looks like. Oh, it's loading, sorry. For SLO1, I've just made these notes in the form of PPT presentation type, okay? So you have basics coming up. Sorry, it's a bit loaded. It hasn't loaded yet. Okay, so you have the theory component of all of this, but you also have algorithms. So this is like a flow chart of what you're supposed to do. And then you have these SBAs. Okay, these are like one-liners, recalls from your past exam questions. So that's how it's built. Okay, this is just one of the notes as an example. All right. So that is the end officially of our introductory lecture. If you still have questions, please ask away. We're going to give you have a few more questions.
One thing I want to add
Sure.
is after every lecture, so after every lecture, what you will do, make your notes and start solving the questions from any resources. Okay, in that way you will be able to understand where you will struggle, and you will be able to understand where you are right now. Okay, so that uh, you can ask any question, you will have any difficulties, so you will start uh, imposing those difficulties on initial basis. Okay, not in the end, because in the end of the exam, or in the end of or in the close when the exam is near or very close, so you will be in a very anxiety state. So it's more difficult um, to cover the components or the parts which you are struggling the most. So try to make the notes and start with the questions so that it will be very easy for you in that.
Great.
Yes, Doctor.
Thank you, Dr. Saqib. Any questions from any of the mentors or for me? Ask away. If not, that is technically the end of the introductory lecture, so you are all free to go. Any QBank? Yeah, my QBank recommendation is RChem Learning if you want to buy it. Other than that, we do have an MCQ pool that we have collected that we will be sharing with you throughout the course, other than RChem Learning. Share lectures in Google Drive. We will. Don't worry. We will share them in Google Drive. Right, you're welcome, everybody, and we will see you live, hopefully in August. But before that, you will see us very often in the Telegram group with what's going on. I would encourage all of you to be interactive, okay? You have 3 people who've done this exam. Ask any question. We will answer in any way we can. We can even send a voice note if that's what it takes to help you understand a concept, a video is required, or just discussion. We will do whatever we can to help you get the concept. Okay, I hope that helps, and we'll see you all soon.